Welcome to Beyond the Data. I'm Dr. Phoebe Thorpe, and here with me today is Dr. Brian King from CDC's Office of Smoking and Health. Thank you for joining us, Brian.
Thanks for having me.
The session today was on e-cigarettes. Very interesting. I was very surprised at the number of problems there are with e-cigarettes, especially regarding people's health. Can you tell me some of them for our audience?
There's still a lot we don't know about e-cigarettes. These products came to the United States around 2007, and they're currently unregulated at the federal level. So there's still a lot we don't know about what the ingredients of these products are or what the long-term health effects are. But we do know enough to say that they are dangerous for youth, and that youth shouldn't be using any form of tobacco product, irrespective of whether it's electronic, combustible, or a smokeless tobacco product. And one of the common ingredients in all of these products, including e-cigarettes, is nicotine, which we know is not risk-free. Outside from being highly addictive, it can also harm the developing adolescent brain and also lead to fetal toxicity among pregnant women. So the nicotine is a concern in these products for these populations, youth and pregnant women. But there's also other ingredients that have been identified in e-cigarettes that could potentially be harmful to people, including ultrafine particulate matter, volatile organic compounds, and other potentially dangerous ingredients.
And those, the ultrafine particulate matter, those are all in the aerosols, so it's not just water vapor that you're breathing in.
Yes, that's really important to note that it's not harmless water vapor, and it's actually an aerosol that can contain harmful and potentially harmful ingredients. And since the products aren't regulated, it can vary from product to product.
And one of the things that I had heard today that I actually found quite alarming was the mention of the flavorings. One of the flavorings is associated with bronchiolitis obliterans, which is a big word for permanent scarring of the airways of your lungs. That means so permanent, and the airways of your lungs, you'd have difficulty breathing. What else is known about the flavorings that they're adding to the e-cigarettes?
So there's a large diversity of products currently on the marketplace. There's over 450 brands and thousands of flavors. And users can even create their own flavors if they go to vape shops. But what we're seeing is an emerging body of evidence demonstrating that there are some potentially harmful flavors that are being used. And it's also important to remember that some of these flavors, although they may be recognized as safe for ingestion, for people to ingest in food, we don't know what the health effects are for inhalation. And that's how people use e-cigarettes. They inhale the product into their lungs. And so there's concern that some of these flavorings in particular can really harm the lungs, particularly among vulnerable populations.
And coming back to the vulnerable populations, you briefly mentioned youth. Tell me again, what is it we're so worried about with youth?
So with youth, one of the primary concerns is the inclusion of nicotine in these products. And the 2014 50th Anniversary Surgeon General's report was clear that there's potential for nicotine to harm the developing adolescent brain. And in addition to harming the brain, we also know that nicotine is highly addictive. And so it could potentially lead youth to a lifetime of nicotine and tobacco addiction.
What have we learned about tobacco that we could use with the e-cigarettes as far as concerning controlling and use?
So there's a strong evidence base from several decades, 50 years of tobacco prevention and control interventions, and we really know what works to effectively prevent tobacco use. And e-cigarettes can be included in a lot of those interventions, the most notable of which is youth access restrictions. We know that it's dangerous for youth to use these products, and that interventions to restrict the sale and access can reduce youth use of these products. There's currently several states across the United States where it's still legal for youth to walk into a mall kiosk or a convenience store and legally purchase these products. And there's also widespread internet sales as well. So youth restrictions are really a key lever to prevent youth access. Another is including e-cigarettes in clean indoor air restrictions, where conventional cigarette smoking is otherwise prohibited. And this helps to maintain a clean indoor air standard so that we can prevent exposure of non-users, particularly kids and pregnant women, from exposure to the aerosol from these products.
And those are both things that are regulated at the state level of the age that the nicotine and e-cigarettes would be available and the indoor air. Some of the other things that we mentioned today was just knowing yourself as a parent or as a clinician what the risks are so that you could speak to somebody about what what they might not know. What are some of the other things that could be done beyond the things that we've mentioned so far to make people more aware of the risks of e-cigarettes?
So I think it comes down a lot to education, particularly parents and clinicians on the individual level can become educated about the potential harms of e-cigarettes among kids, because we know that most adult tobacco users begin before the age of 18. So if we can implement interventions to prevent them from starting before the age of 18, we could potentially prevent them from a lifetime of nicotine and tobacco use. And the same would go for e-cigarettes. And so at the individual level, education is really key, but we can't underscore enough the importance of population interventions, which we know work to effectively reduce tobacco use and help denormalize these products among youth and young adults across the broader population level.
And do you have some examples of that? I was wondering, we had, at the end of the session, a great presentation about mass media and hard-hitting campaigns. Can you speak a little bit to that?
Yeah, so we know that emotionally evocative, hard-hitting mass media campaigns are a very effective mechanism to educate people about the adverse health effects of tobacco use. CDC's Tips from Former Smokers is a prime example of a campaign that's been implemented since 2012 to educate people about the adverse health effects of smoking from former smokers themselves who have experienced adverse health effects. Currently, there's no broad-based mass media campaigns to address the issue of e-cigarette use focused on youth and young adults and the potential harms, but it still speaks to the importance of education, and that it's important to reach out to youth and to counter some of the messaging, because e-cigarettes are advertised heavily via television, for which conventional cigarette advertising has been banned in this country since the early 1970s. So there's definitely pro-marketing influences for e-cigarettes in multiple different media, and it's important to counter that message for youth and young adults so they understand the harms of using e-cigarettes and what that impact is in their long-term health.
Yeah. So if somebody was interested in finding out more about e-cigarettes and tobacco, where would you tell them to go?
They can go to CDC's tobacco website, which is www.cdc.gov/tobacco. And that has several resources on proven tobacco control interventions, as well as information on e-cigarette use and interventions and educational materials.
Yeah, sounds like a great place to go to find out more. Yeah. Thank you so much for joining us.
Thanks for having me.
And thank you for joining us. See you next time for Beyond the Data.